How would you like it if you go to your patient portal with your physician health plan, you go to your portal to see your test results, to find out when your next appointment is, and you're hit with an ad for a Medicare Advantage plan right through your doctor's portal? And worse, it has one link there that can transmit all your information, your drugs, your diagnosis, your doctors, everything, to an insurance agent who will then use that to try to get you to sign up for their Medicare Advantage plan. I've seen a lot of things in this industry, and I've been in the industry for over 25 years. I've never seen something as degrading and or ethically irresponsible as this. Advertising on a client's patient portal, an insurance product, it's just beyond the scope. There's a reporter who's been in the industry for 30 years that's been researching these things about Medicare, what's happening, what are the trends, what are affecting seniors. And today I'm going to let you hear in her own words what she discovered. Let me just tell you a little bit about this person. Her name is Cheryl. I've been following her for a long, long time. She's a highly acclaimed reporter. She's on a webpage called MedPage Today, researching all things having to do with Medicare and senior issues. And in this particular article, let me just go into it, actually show it to you. You're not going to believe this. Let me move out of the way. So it says Medicare Advantage ads in your patient portal. CMS says they shouldn't be there. Then why are they there? Makes you wonder. Patients are outraged when portal mixed with a Medicare Advantage sales pitch with the doctor's notes involved. This is just sick. You've seen the commercials, Joe Namath, J.J. Walker, heck, even Mike Huckabee now pushing these plans, and they probably wouldn't be caught dead on a Medicare Advantage plan because they can pay for a Medicare supplement and go anywhere that they want to. By the way, if you have no idea what I'm talking about, what is a Medicare Advantage plan? What is a Medicare supplement plan? I'll go over a brief rundown in just a second, but this is just hideous marketing practices right here. Let me just share with you a little bit of the article, and then you can hear in Cheryl's own words what this means. When John opened his electronic health record portal in November recently to check for reports from his doctor's office, he was shocked and offended. There at the top of his inbox was a message suggesting that he enroll in a Medicare Advantage plan. What the heck? Review your 2023 Medicare Advantage coverage options, it said. An annual enrollment period began October 15th, trying to push him into the plan. Let me move over to this side, make sure. There we go. That's a little bit better. For a second, he thought his doctors might be suggesting he enroll. Obviously, why wouldn't you? Which he felt would be highly inappropriate. But as he read, though, he realized the message came from Follow My Health, the company that operates his portal for his North Carolina-based system. It should, he said, if he should click on the link, he could get a personal code powered by their partner, eHealth, a major call center in the Medicare Advantage space, a licensed independent insurance agency. Automatically, the code would securely share your prescription and doctor information with our partner. It would also allow him to see Medicare Advantage plans that may have your doctors in their network and may cover your prescriptions at an affordable price, and most affordable price. He's 74, and he deliberately rejected Medicare Advantage before out of concerns about its significant downsides, opting instead for traditional Medicare and a supplement plan. Suspected something was very wrong. Isn't that interesting? That part right there. If not flatly illegal, he said, it is morally wrong to solicit Medicare Advantage enrollment through his health portal. Quote, I felt that they were using a trusted platform of my healthcare provider without, I suspect, the consent or knowledge of my provider, the Asheville retiree told MedPage Today. After asking some of his doctors in the Mountain Area Health Education Center network whether they knew or approved of this solicitation, his suspicions were confirmed. They knew nothing about it, they told him, and they were dismayed with the practice. Unbelievable. Quote, being a paid supplier of patient portal services that places FMH in a quasi-fiduciary relationship, he said, it should not take advantage of the trust to promote its own independent interests. MedPage Today sent the Center for Medicare and Medicaid Services, CMS, screenshots of the communication that Hayfeld had received and asked about the appropriateness of this use of these messages to solicit Medicare Advantage enrollees. Quote, an organization company should not engage a patient through their healthcare plan patient communication portal with a purpose to market to or solicit enrollment into a Medicare Advantage plan, end quote. An agency spokesperson said in response. She referred to an October 19th memo on best practices that was just last year, sent to Medicare Advantage plan sponsors, including third-party marketing organizations. That's just absolutely unbelievable. The spokesperson for the network there of doctors said in a statement, although her rural and nonprofit medical center did not send the messages in question, nor did we know these particular messages were being sent, we regret the negative experience this gentleman had and appreciate that he brought it to our concern. By no means do we wish to imply that these third-party messages are an endorsement. So how would you know? It's just, how would you know if you're being pushed this information, and with one click that you could erroneously do by accident, all of a sudden now you're going to have your information sent to. Has anybody out there, please comment below on this video right now. Have you been one of the people that have received a questionable marketing practices about Medicare insurance? Have you been cold called on the phone repeatedly day and night? How about your table during the annual enrollment period? Does it stack up this high with Medicare offers? Or God forbid you're turning 65 and people know what your address is. They'll blow up your phone, your email, every ad that you come in contact with, because they want to push this stuff on you. Now, there's nothing wrong with traditional advertising if you're done in the right way. I've always found in my career that if I put out enough information that's going to be beneficial and help people, then what happens is people find me. I much prefer that because people know me, like me, and trust me. Then they call in. It's much better than cold calling people, constantly barraging them and trying to get them to take action on something. But that's just me. So I want you to see something here. In case you're not familiar yet, let me just put this on. What is the difference then between original Medicare, which we highly prefer, and it's not available to everybody, I understand, because not everybody can afford to go on original Medicare when they're 65. But let me just tell you this. You paid for it. You paid for original Medicare your whole working life. And if you've worked 40 quarters or more, you're entitled to original Medicare, and you should be able to get it. But what's happening is seniors are not being told by unscrupulous agents, in my humble opinion, they're not being told that they've got a choice to stay on original Medicare. They can. And if you go on original Medicare, you can get what's called a Medicare supplement to supplement or fill the gaps of original Medicare. The original Medicare typically generally pays 80% of your costs. But with that, you can go to any doctor, any hospital, anywhere in the country without a referral, without prior authorization, to get done what you and your doctor believe you should get done. Now, if you've heard some of the horror stories of managed care, the Medicare Advantage plans, then you know what I'm talking about. That difference is crucial. What is the difference? Well, if you go on, let me show you right here. Let me get out of the way so you can see it. There we go. If you go on original Medicare, again, there's no network. You can be using this anywhere in the country that accepts original Medicare, which is most every doctor. No prior authorization. Some people call it pre-authorization, but you're getting it prior to the thing happening, so it's prior. No referrals required, and very low out-of-pocket costs once you've got the insurance in place. And it's guarantee renewable. The terms of your Medicare supplement are like a life insurance contract. It's going to be there, and it's not going to change. Conversely, if you do go down the path of managed care, that's a Medicare Advantage plan, then you are going to have a restricted network. And if you go out of an HMO network on a Medicare Advantage plan, and it's not a life and death dire emergency, you are not falling back on original Medicare. A lot of seniors don't know this. You're not getting back on original Medicare then just because the health plan that you signed up for, your contract says that's out of network, you can't have it done, or we're not going to authorize that because it's too expensive. You need to go do the cheap thing first and suffer in pain. No, you don't fall back on original Medicare. You're done. You can go pay for it out of pocket if you want to, but if the health plan says they're not covering it or it's out of network, you're done. You cannot have it done unless you pay 100% of the cost out of your pocket. That's what agents are not telling people. And the new marketing rules just came out for 2023 from CMS, is the date I'm making this video for you. They don't still address an agent having to let you know that you could have stayed on original Medicare. You could have gotten a Medicare supplement plan. And because they pay twice the commission for somebody new to Medicare, an agent's not going to tell you about a Medicare supplement plan. It blows my mind. So on managed care, you've got the restrictive network in most all cases. You've got prior authorization. You've got up to, and this is depending on the health plan, depending on your county, because all Medicare Advantage plans are county specific. They're not for the entire state. They're not for the entire country. They're county specific. So you've got up to a $7,550 annual max out of pocket. Now, agents will actually twist that and tell you that's a good thing. Oh, it's great. You can only pay up to this per calendar year. Guess what? January 1, it resets. Now, some plans are less than that. Some plans are much less than that. Good for them. Just bear in mind, if the plan didn't authorize you to have the treatment, if the plan says that what you're going to is out of network and you're in an HMO, it's not paid for. It doesn't go toward your max out of pocket. You can't just say, well, they want me to have all this chemo and I want to go to the best place in the country to have it done, so I'll just use my max out of pocket. Doesn't work that way. Your max out of pocket only gives you credit for what you're paying if everything is authorized within the health plan and you're going to a network and you're behaving yourself and doing everything they say to do. Those managed care plans, the Medicare Advantage plans, are calendar year contracts. It's important that you know that. They do and they can change every single year. What you enjoyed last year may not be the same thing you enjoy this year. So every year, and Cheryl talks about that in her interview, you'll hear in just a second, every year you've got to spend all the time researching those plans. And the copays are different. It's not just one standard plan anywhere. And like I said, yeah, the benefits change. But again, this is the choice that most seniors are not told. They can either do original Medicare or they go for one of these plans that are heavily, massively marketed to you. And as Cheryl just found out, even showing up in your health portal. Those plans are called things like, it's the all-in-one plan. It's Part C of Medicare. Yeah, that's what you're getting. That's what you're being told. And it's important that you share this information, if you have not already done so, with somebody that's facing right now, what do I do about Medicare? Please take the link for this video if you're on your computer right now or your phone or however you're watching it. Please share it in your Facebook feed. If you're part of a group, if you're a part of a Facebook group or a network group or a LinkedIn group, and someone's going to have to face the question, which way do I go when I'm eligible for Medicare? I'm leaving my employer plan. What should I do? It's important to know what the options are. And original Medicare or the Medigap policy is not being told to seniors. So it's something that they should at least be given the option to going with, wouldn't you say? So please share this link, this video, with somebody who may be facing that choice right now. So if you're going to find any positive things about this video whatsoever up to this point, please leave it a thumbs up. And I really want to hear your comments below on what kind of marketing practices you've been exposed to since you've been eligible or you're eligible right now on Medicare. And this is how to contact us. But I really want you to hear, you can scan that QR code. Isn't that colorful? Isn't that neat? You can scan that with your phone just by taking a picture of the screen. Don't take the picture, just hold it up to it with your phone. And from even clear across the room, your phone will recognize that that's a special code, and you could call our office if you want any help with Medicare. Our service is completely free. We don't care which plan you go with. We just want to present you with all the options in an honest way so you can make a choice. If you want Medicare Advantage, if you want Medicare Supplement, if you want life insurance, we could even help with that. But this is how to reach us. And if you do scan that code, it'll say, do you want to call them? And you hit call and you call our number. You can leave a message after hours. We're always there. But I want you to hear in her own words Cheryl's reaction to when she found this information about what's going on the health portals. This is quite interesting.
Thing that we have to bring up, and it was a recent article that you put for the website, and that is that, again, in adding extra layers to this and adding extra greed, I suppose, when patients go on their portals to look for advice, messages from their doctors, lab results or whatever, they're now getting advertisements for the Medicare Advantage plans. And these are, to some people, kind of suggest that maybe your doctor is endorsing this, which is farther from the truth, right?
I'm so glad you brought up that last story I did, because this just outraged so many people. It turned out that this gentleman who emailed me from North Carolina, he told me his doctors didn't know anything about this. And indeed, the PR person for his health network in western rural North Carolina did not know that they were doing this either. And I am still in my efforts to try to figure out how they got around doing this, because the message that he got in this portal said, if you click on this personal code, your drugs, all your drugs and your doctors will go to our partner, who was an insurance agent, who's going to sell a Medicare Advantage plan. And I think the naive, innocent, user of this portal would click on that thinking my doctor wanted me to do this. I don't know why this didn't violate HIPAA, the Health Insurance Portability and Accountability Act, which, when I go into my portal, I want that stuff. I don't want everybody to know, how many milligrams my doctor wants me to take of that statin, how high my cholesterol is, or, that's a big concern.
I'm absolutely outraged. I didn't know that. That shows you I haven't been on my portal in a long time. And this is the way that the web works too, because there's a lot of places to click. There's a lot of offers, and this is playing sort of a shell game on what should be a government website, and why that is. I want to cry.
Yeah, it's supposed to be regulated, or I would think it would be regulated by Health and Human Services Office of Civil Rights, which oversees HIPAA compliance. But apparently there is a loophole that some of these platforms, these portals, that in this case it was Follow My Health, are able to use some sort of a loophole involving a business associate agreement with the health system that allows them to send users advertisements like this. If they say, yes, I want my message, that somewhere there's apparently a default which says, yes, I want all my messages. And so they feel that's an entitlement to send you this sort of nonsense. No, this is my private portal.
It's your private portal. People should not be allowed to sell things to you. It should be information only.
Yeah. We have another layer situation now where the doctor has set up a portal, but the doctor's office doesn't run that portal. They field that out to somebody else, some other company that runs the portal. And that company says, well, we're going to sell you ads as a way of making money off that portal. And so your doctor probably doesn't even know that the portal has ads running on it.
That was the case here, with the North Carolina issue. I have just got a message from the Center for Medicare Advocacy, which is a big organization of attorneys who advocate for Medicare beneficiaries. And one of their staff people received the exact same message from the same portal, Follow My Health. So I don't understand the arrangement. You're right. The doctor didn't know about it. The health plan, which is called the Mountain Area Health Education Center, their representatives told me that they didn't know about this and they regretted it. They weren't endorsing this. I guess they thought that all of their users were going to be smart enough to figure out the difference between a message from their doctor and a bald ad for a Medicare Advantage plan. But I just worry that a lot of people might not, when you forget things, you don't know, maybe you're not that used to using computers. I don't know.
We as insurance agents in this industry have to do better. We have to raise the standard. And for all we hear from Medicare about what they're doing to enforce marketing rules on us for dealing with seniors, this year they're bringing back a 48-hour cooling off period. And that is if you reach out to an agent, you say, I want your help with Medicare, you have to wait 48 hours before the agent can actually sit down with you and have a meeting with you, even on the phone, to go over your options with Medicare. This is Medicare's idea of a senior protection device in there. 48-hour cooling off period. Cooling off from what, I would add. They did away with that rule in years past. Now they're bringing it back as that's going to protect seniors. I'll tell you what would protect seniors is if you would make agents obtain from the senior a waiver, an acknowledgement that if you join a Medicare Advantage HMO plan, you are leaving original Medicare for all practical purposes. You cannot enjoy the benefits of Part A and go to any hospital. You cannot enjoy the benefits what would have been on original Medicare's Part B and go get your X-ray, your MRI, your CAT scan, your diagnosis from anybody in the country like you could on original Medicare. You're giving all that up. But yet no agent, except for people in my office and close friends of mine that I know that feel the same way, have the integrity to tell you what you're giving up. They just say, this is free, just sign here. It's free. What could go wrong? You're healthy. You'll never need to worry about it. And by the way, you've got that maximum out of pocket to protect you and your pocketbook. Well, how well does that work when you find out one day that you traded in the ability to go to Johns Hopkins, Mayo Clinic, MD Anderson, the Cancer Treatment Centers of America, or anywhere else that does not accept an Advantage Plans HMO network, and you traded all that in for a free tube of toothpaste or zero premium, and you find out, wait, that's the only place that can possibly treat my condition? Now, I'll address it right now. I've asked you to comment below, and I'm going to tell you this. A lot of people do comment that they're on a Medicare Advantage plan. They've been on it for 6 months, 9 months, 12 months, 2 years, and they've never had a problem. Well, I'm so glad. My grandmother did have a problem, and that's what got me in the Medicare business to begin with. People do have problems, and if you'll read more, if you'll learn more, like at my website called allaboutmedicareadvantage.com. That's a good one. Allaboutmedicareadvantage.com, where I've started to chronicle all these stories, all of these investigations about this industry, which is rife with fraud, and yet still, it seems like nobody in Washington seems to care enough to step up and say, seniors need to be protected by law. We're going to require that they have to sign this affidavit understanding, this acknowledgement, and a waiver saying, I'm opting out of my original Medicare. I understand that I paid for Medicare my whole life, but because this insurance company wants to make gobs and gobs of money making false diagnosis and false claims under my name, I'm going to opt out of original Medicare and just put all my life and my trust and everything else with them. We're not just talking about life, by the way. We're talking about ongoing pain. I've heard it said a lot of times in life that having excruciating pain over a long period of time is worse than actual death. And yet that's what we've experienced with the stories we've gathered over the years of thousands of people who've been stuck on such plans. We do everything we can. If you should see the video that Kendall did in my office, everything we could to get people out of those plans when they're experiencing these things. But yes, if you just hear the sales pitch from the industry, if you're just watching television, you're watching poor Mike Huckabee up there pitching these things. I'm a former presidential candidate and I'm endorsing this plan. It's free.
Hi, I'm Mike Huckabee. You may know me as a former governor and presidential candidate. These days, like you, I'm a private citizen now on Medicare.
My gosh, people, we've got to raise the level of integrity in this industry, and we've got to do it soon, because 10,000 seniors a day are turning 65, and they're being fed a line of bull from most of the agents and the commercials and the huge industry out there trying to take advantage of government money to siphon it off from what should have been a good program, which was original Medicare that you paid into and, more importantly, you earned your whole life. Anyway, that's what we do here. We try to find you the best alternatives, and it could be a Medicare supplement for you. It could be a Medicare Advantage plan for you. We're not going to pick it for you. We're just going to give you free education so you can make up your mind. And if you like us and you like our information and you trust us to look out for you year after year, then yes, please let us help you with your health plan. If not, then we can part as friends. But at least I know I can sleep well at night knowing that you got the full story and not just some sales pitch. God bless you. I'm Chris Westfall. Take care.